I was a primary care physician, and honestly, as a primary care physician, I did not treat many people with alcohol use disorder in my office. And why is that? Primary care is so. So first off, you need more training than most people have, right? If it's not a one size fits all medication. Okay, naltrexone or any of our other anti-alcohol medications. So you need someone with training and experience. And in some cases, that's not a physician. I mean, the 3C Foundation's done a phenomenal job with non-physicians managing naltrexone and has learned a lot. You need the training and experience. And for most physicians, they get all their training around alcohol comes during the acute management of patients in alcohol withdrawal syndrome in the hospital or alcoholic hepatitis. So they only see one small piece of the puzzle, and in those cases, all those patients have stopped drinking completely and have a goal at that moment in the hospital of not returning to drinking at all. Okay, and so in that setting, naltrexone is not particularly useful. Second, naltrexone has a lot of adverse side effects. I mean, some people really don't tolerate this medication. You really got to work to find the right dose. Third, even if you find the right dose, sometimes people need more than one tablet a day, right? And again, you have to know how to increase the dose and manage that, right? So it's really specialty care. It's a little like saying, well, doctor, like we know that heart attacks can be treated with these medications, and you should just go ahead and treat heart attacks, all of them, and you'd say, no, wait a second. I'm not a cardiologist. I'm a gastroenterologist, or I'm a gynecologist. I'm not, like heart attacks can kill you. Well, you could read the recipe, right? And just do it. No. So this is specialty care. I think that's one of the things that's really important for people to understand. This is specialty care, and it's important for doctors to understand that too. And if you're going to engage in specialty care, you need specialty training. Can that training, is that many years to become an expert in alcohol pharmacotherapy management? No, but you need to have the training and get the experience. And most primary care doctors have not had that training and don't have that experience. And they're busy with a lot of other really important stuff. I mean, they're busy with, diabetes management, hypertension management, managing heart failure. That's complicated enough, right? And important enough. So expecting one of the pet peeves of every primary care doctor is if someone really doesn't think a problem is important, right, they shove it onto the primary care doctor, right? Let the primary care doctor screen for this or do that. It's the same thing as saying it's not an important problem, because you're asking someone who is really smart, really hardworking, is not afraid of tackling a wide diversity of problems, but has had no training to take on a problem. And you get what you train for, in these things. So I think one of the beautiful things that telehealth is going to bring to everyone is the ability to have more specialized care, easily have access to specialty care. And I think primary care will really become a field focusing on integrating the multiple issues that patients have into care pathways, with referrals and monitoring those things. I mean, I think a primary care doctor monitoring your alcohol treatment through Ria is not a bad plan. If they want to see the information, we can give it to them. But expecting them to do specialty care for diseases that can have high lethalities, is not a good idea. But people probably don't know, more people die every year from alcohol-related diseases than do from diabetes, right? So but no one's really, but endocrinologists, if diabetes is not responding well, there's this whole specialty that takes care of, when no one says, primary care has to handle every case of diabetes, right? And without any specialist, and maybe that death rate, the fact that it's about the same as alcohol, is a successive treatment through that pathway, right? But at any rate, no. I think going forward, the best management for addictive disorders will be through a specialist who are trained, certified, and have an adequate volume of cases to really learn from. and not through your primary care doctor.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.